Let's talk about other resources or other things that you came across that might help. May have helped in your case, but they might help the viewers who are in a similar situation. One thing you did mention to me was the possibility of the support groups, which have been started now in that department, the esophageal gastric department. Did you start to attend those groups early on?
Well, they've been going now for, it must be, I think we're in our second or third year now. I attended them right from day one. And the interesting thing with that was that when I first was invited to go along to them, I thought, yeah, there's going to be a few of us there. Not too many, because I was a little bit insular with it. I thought it was just going to be for esophageal cancer patients. And we went to the first meeting at Helen Webb House. And the place was absolutely packed. Okay, they'd invited patients and carers and partners along, but there must have been 40, 45, 50 of us there. And that really surprised me and encouraged me, because it does make you realise that it doesn't discriminate, cancer. It doesn't pick anybody, it just picks anybody at random. And the encouraging thing was that although, okay, 2 years ago, I was probably 5 or 6 years down the road then, so I was one of the old stagers, if you like. The encouraging thing was that there were people there who could offer me advice. And that worked both ways. As a group, I think it's a very, very worthwhile group. There's a lot of cross-information goes on. A lot of people are prepared to listen to what you say. And of course you listen to what other people say, because everybody's different. A lot of the sort of mental aspect of this, you know, the positivity, you don't get that with a lot of people. And I think once people come along and see people who are 7, 8 years down the line and look reasonably good on it, and have got a good story to tell, they'll listen to you and they'll take that away. And it picks them up then and builds them up. There's a lot of potential benefits from a support group. Very much so. Yes. And it's a mutual thing. You can give to somebody and you can also receive from them. Yes. And the other good thing about it is that the first couple that we did, it was very, very much the dietitians opening it and Mr. Bowery opening it and then leaving us to our own devices and just discussing, which is good. But then we now have specialist talks, you know. We get talks from oncology, we get talks from the physiotherapy people, caring for cancer people, Macmillan, and it's all good knowledge. And it's done at the right level as well. You're not talked down to, you're invited to chip in and contribute to everything that you want to talk about, and it's an excellent group, it really is. And but you can learn so much. There's so much you can learn from it, because everybody is, as I say, is different, and not everybody's got the positive attitude. But there's always something that you can learn from it. But what is it you think to yourself when you see other patients at different stages to you? Either somebody who's more advanced or in a different demographic group? Yeah, there are certainly lots of different demographic groups there. One of the things that we were fortunate with this was financially, we've never really struggled, and it's not impacted on finance with us, but some people it does. Yes, sure. And that must have had a tremendous strain, as well as the physical well-being, to have to worry about finance. It's a different element, yeah. Yeah, but when you talk to Macmillan and when you talk to organisations like that, there is always somebody there who can help you out, filling forms in, making sure you're getting the right benefits if you need them. It's never applied to us, but you know, you can tell that there are people who have got the extra strain, if you like, as well as getting their health back. and getting back to where they were before the operations, they've got this other sort of burden as well. And that's why groups like this are so good.
Yeah.
You know.
And you mentioned about the groups, you mentioned about family, importance of family, and your own motivation to improve and your own goals. Is there anything else that you'd say is important, you know, in that phase where you're trying to get back to as normal as you can?
Yes. One of the most important things is that you do have to appreciate that it's not a quick fix. It takes a long, long time. And it's taking small chunks and little steps. You know, once you've got your mind right, you've built the first block, if you like, and you're on the road. But the most important thing is you must never ever think that it's going to happen overnight.
Yeah.
It took us 15, 18 months to get the dietary side right, building yourself up to some sort of strength. You have to take it a step at a time and be prepared for a long journey.
Yep.
Yeah.
One aspect that we don't emphasize much now, but we're trying to develop in the future, is the possibility of meeting individual patients and keeping a link with them, like a mentor system.
Yes.
Have you come across any other patients who you've really clicked with?
Yes, there are one or two. Certainly one at the specialist group. We always make a beeline for one another, and we go through our experiences and have a chat. And the other interesting point that you just brought up is the mentoring side. I was asked to do some mentoring as part of this. Yeah, about 18 months, 2 years ago.
Yeah.
Kathy Thompson asked me to go along and do a home visit for somebody who was not sure about what to do with exactly the same condition that I had.
It's actually a very valuable role. Whether or not the hospitals support it is a grey area, but it is definitely valued by patients who receive it.
Yes.
And did you do that role?
I did it, yes. We did a home visit, both of us went. Okay, we didn't get any feedback from Kathy because of patient confidentiality. Yeah. But I certainly found it very worthwhile.
That's excellent.
And I think the lady involved did. As I say, we're not quite sure what happened in that case, but it's certainly something that I feel is very worthwhile.
It sounds like you did a valuable role.
I would hope so, and I would certainly do it again if I was asked to do it. Yeah. Yes, wouldn't worry me at all.